Secretary Leavitt asked the state of Louisiana to provide a plan on how to rebuild the nation's health care infrastructure. Though much disagreement was encountered and difficult decisions were presented and made, the state and its various stakeholders, public and private, held up their side of the bargain, and they produced a plan. That plan, known as the Collaborative, was transmitted by the Governor of Louisiana to Secretary Leavitt on October 20, 2006, about 6 months ago. The state's plan called for a series of pilot projects for Region 1, where the devastated parishes are located in and around New Orleans. What Secretary Leavitt sent back is not even a formal plan. It is a loose confederation of spreadsheets and bullet points that ask the state to disassemble its statewide public hospital system and replace it with some form of insurance program. A most curious consequence. There are almost no specifics in the plan, and at least none are available to the public. There is not even a formal publication from the Secretary to the Louisiana Governor that this committee could review, despite the requests of this committee to obtain such a document. And we will again, at the appropriate time, ask the Secretary to make such document available to the committee. The state of Louisiana now counters that the HHS proposal will not work. Now, I do not bring these points up to point fingers, but to suggest that we're now facing a deadlock between two very important players who are needed to solve these problems. If not fixed quickly, the next 6 months will be spent on dueling spreadsheets. Simply put, the plan proposed by Secretary Leavitt, regardless of your opinion of the state system, is simply too large a task to undertake at this time. Even if adopted, it will not address the immediate problems faced by patients and the practitioners in this region. I therefore call on the Secretary of Health Human Services and the Louisiana Secretary of Health and Hospitals to immediately convene a series of meetings to re-energize the next steps on how to move forward. Both are at an impasse, and a serious one at that. If not corrected, this situation will jeopardize not only progress that has been made on the ground, but also the future of the region. And I would note that this committee will be having further hearings to bring the Secretary and others before us to explain what they are doing and whether progress has been made as a result of these hearings today.